Hi, I'm Dr. Jomaa. Welcome back to my channel and this series on osteoarthritis. In our last video, we explored the relationship between exercise and osteoarthritis, emphasizing the importance of addressing underlying risk factors. If you haven't watched that video, I recommend you check it out first. Today, we'll continue to delve into this relationship, examining how sports participation and employment, particularly laborious jobs, can impact the risk of osteoarthritis. As always, please remember that this is general, educational, and informational content. It's designed for your entertainment. If you've got any medical problems yourself, please go and see your own doctor. So there's a vast body of evidence supporting the benefits of regular exercise. Exercise improves our general health, increases the longevity of our lives, and has many other holistic benefits. However, with the rising popularity of recreational and competitive sports, questions arise about the potential risk of developing osteoarthritis. Let's begin by examining how exercise affects cartilage health. Hyaline articular cartilage, which lines the surface of our joints, responds to mechanical stimulation. Studies suggest that both inadequate and excessive mechanical force can impact cartilage health. Observations in children indicate a positive association between physical activity and cartilage volume. Research in athletes has shown mixed findings. Some studies report an increase in knee cartilage in those who exercise, whilst other studies have found no significant difference in cartilage thickness between athletes and non-athletic controls. Longitudinal studies suggest that physical work capacity is protective against cartilage loss. Interestingly, the absence of normal joint loading can lead to cartilage thinning. So this suggests that exercise in moderation actually improves the thickness and health of our cartilage. This dispels the common misconception that exercise is inherently detrimental to joint health. Cartilage doesn't just wear and tear like, for example, the suspension in our cars. Rather, moderate loading is required in order to bolster and protect the health and structure of our cartilage tissue. The evidence base suggests that recreational exercise, especially low to moderate impact activities, do not appear to pose an increased risk, but high-level sports participation, overuse, and injuries are potential causative factors for osteoarthritis. The risk seems to go up the higher the level of sport, and so in elite professional sport, the risk is even higher. Elite sports participation, particularly in high-impact and high-intensity activities, shows an association with an increased risk of OA. Explosive power sports like ice hockey or wrestling may contribute to a higher prevalence of osteoarthritis in the hips and the knees among elite athletes compared to non-elite counterparts. The likely reasoning for this is due to the high intensity at this level of sport. Another explanation is that at the elite level, athletes have a lot of pressure to play and perform even through injuries. Athletes will often take pain-killing injections in order to get through a game, and this can be detrimental for their joint if it's not fully healed when participating in high-demand elite sport. Also, occupations which involve repetitive movements, heavy physical workload, and specific joint stresses such as knee bending or hand use can contribute to the development of osteoarthritis. For a more complete understanding as to the risks of exercise, we need to talk about the risk of sports injuries. Traumatic injuries, for example, an ACL injury or a meniscal injury in the knee, are far more likely with sports participation and can lead to instability or malalignment around the joint. These injuries will significantly increase the risk of developing osteoarthritis. If joint instability is one of the leading risk factors, then exercise is an excellent way to improve the stability of a joint. Exercise is not merely a preventative measure, but also a powerful therapeutic tool in managing osteoarthritis. Targeted exercises aimed at improving muscle strength, stability, and range of motion can lead to significant reductions in pain and improved joint function. As sports and exercise physicians, we play a role in guiding individuals towards exercise regimes that suit their specific requirements. Developing personalized exercise plans tailored to individual needs is paramount for optimal OA management. Exercise is an effective drug, it just has to be prescribed correctly. One of the big take-home messages today is that exercise can both be detrimental as well as protective for osteoarthritis. Moderate exercise can have a positive effect on cartilage thickness and overall joint health. On the flip side, if our exercise involves high levels of demand on our joints with an imbalance of loading, high shear forces, and in the setting of an unstable joint, then exercise can end up being detrimental. One of the first steps with all my patients who present with osteoarthritis is to discover where their weaknesses are, what's unstable, and how we can improve these functional deficits. Addressing underlying mechanical deficits through strengthening exercises will help facilitate improved joint health and help patients get back to the sports that they love to do. In my next series of videos, we'll start looking at how common underlying functional deficits, which come from our shared lifestyles, result in common patterns of osteoarthritis, which we might see in the knees, in the hips, or even in the spine. In particular, I'm going to start showing you some of the exercises that I commonly prescribe for specific injuries and joint problems. Thank you for watching this video. If you found this information helpful, please don't forget to like, subscribe, and share the video with anyone who might benefit from it. If you've got any feedback, please leave it down below in the comments section, and stay tuned for more valuable insights. Until next time, keep moving and stay healthy.